I'm from the digital department in the Israeli government, so ministry. So everyone who wants to learn even more and actually have a little bit of a battle between Germany and Israel, seen live there on stage about the progress of digital health, please also note that in your itineraries. But now I really have said enough. Mr. Horowitz, I'm very much looking forward to your speech.
Thank you. Thank you, sir. It's a pleasure being with you in Berlin. I'm here in Tel Aviv. I wish I could be there with you personally, but especially is a good representative of the Ministry of Health, and she'll be able to answer all your questions further on. So first of all, I would like to thank the organizers of this wonderful conference. You know, today healthcare systems across the globe face common challenges that existed even before COVID-19. I'm talking about health workforce shortages and burnout rates among this workforce, an aging population that requires more health services, rising demand and rising prices. Each of these challenges requires the application of creative thinking, long-term planning, and international collaboration, not to mention digital tools and innovation. We saw during this pandemic how important international cooperation is, and we continue to strengthen it today here in this conference. Not long ago, we inaugurated a new phase in our long-standing collaboration with Germany in the field of digital health. A 3-year bilateral forum, Israel-Germany, on artificial intelligence, AI, and digital health. This forum will take advantage of the common innovation activities in both our countries. Now, this work will benefit public health and the population at large through the joint promotion of emerging technologies in the field of health. Israel and Germany will bring added value to each other. Governments, I'm a minister, a government minister, and I must tell you this: governments are not the only actor that need to work together to address the challenges of the healthcare system. But governments have a significant role to play in creating the regulatory and economic environment that will enable these necessary collaborations. Governments need to work towards establishing a regulatory environment that is conducive to the development of digital health tools and their implementation in the health system. Governments can also help in establishing standards to ensure compatibility across health systems. We are at a health conference, and it is impossible not to start with the global struggle against COVID-19. So, Israel has finally rolled back almost all COVID-19 restrictions only in the last week. I mean, the last episode was removing the mask. Now it's not obligatory to wear masks in closed spaces, except in hospitals. We have seen in the last 2 years, all over the world, that the social and economic price of closures and lockdowns is extremely high. We have seen extensive damage to the economy, education, culture, and sports, all of which ultimately harm health as well. We also see an extensive damage to mental health crisis because of those closures and lockdowns. Therefore, after 3 significant lockdowns in Israel, we, in this current government, we pursued a different long-term strategy. We left the economy open, allowed free movement, opened the school year on time, and allowed cultural and sports activities. To make this possible, as in Germany, we have laid the groundwork in Israel that will allow us to live alongside the virus for a long time. Not to shut down everything, but to live alongside the virus. Each strategy we utilized throughout the pandemic relied heavily on digital tools, from national vaccine and testing systems based on health information, exchange systems to telemedicine platforms. The effort to combat this pandemic has been 10% logistics and 90% information systems. Let me give you an example. This is my cell phone. Every day, I can, almost every 2 hours actually, 5 or 7 times a day, I get an update on the exact number of vaccines in the exact locations all over the country, with the different vaccine status, the exact number of people hospitalized in hospitals with COVID-19, with the different degrees of severity. I have all this information on my cell phone, not just because I'm a minister, but because we have a centralized digital system and a centralized digital data bank that allows us to have an updated information on the hour from all the different HMOs, from all the different vaccine stations, from all the different hospitals, directly into the Ministry of Health. This is just one example. As we begin to emerge from the shadows of the pandemic, we must dedicate ourselves to developing the tools to be better prepared for the next pandemic or the next wave. These tools are the technology that will save our lives and the lives of our children. They include early detection tools, tools that expand healthcare's capacities in times of need, and tools that gather data to aid decision makers. Israel is an early adapter for implementing digital systems in healthcare. Over 25 years of health information exists in our database. We can go almost 30 years back and have all the data centralized in one place. Since we are a country of such diversity, ethnic diversity, cultural diversity, our data covers a genetically diverse population. So it is very useful for clinical trials, etc. We have a relatively, as I said, centralized system, maybe unlike the German federal system. In Israel, it's much more centralized, and each citizen belongs to a health fund. We have 4 national HMOs, and it's obligatory for each Israeli citizen to belong to one of those 4 HMOs, 4 public HMOs. This HMO system is based on healthy competition between the HMOs for members. So this causes them to try to take advantage of the digital revolution and constantly improve their services. Now, the Israeli healthcare system greatly benefits from the powerful ecosystem of innovation in Israel. There are about, let's say, 700 digital health startups in Israel, 700. Some of them are participating in the conference today in Berlin. We see a great many collaborations that make it possible to imagine a world of better medicine, proactive, holistic, connected, data-driven, and personalized medicine. The challenges we face, an aging population, lack of manpower and physical infrastructure, rising drug prices, require us to think the rules of the game through the use of technology. Using AI, we can imagine a world where new tools enable decision support and diagnostics. Healthcare can become more personalized. Drug discovery can take full advantage of advanced computing technology to reach new discoveries faster. Crisis managers can have better information to guide decision makers, and remote monitoring of patients can enable earlier detection while reducing the load on physicians. Even now in Israel, we have many examples of patients staying at home, and they have all sorts of monitors. Instead of them going to a health clinic or a hospital, they stay at home. They get all the monitoring, and they get the good and the proper care according to their situation without them coming to the hospital. Now, this is the future.